Now to our deep dive into a new flu strain that health experts warn could make for a nasty flu season. The new strain is called Subclade K, and it's already spread overseas. Japan, they've already declared an influenza epidemic, and the UK flu season started a month earlier than usual. ABC News medical contributor Dr. Alok Patel joins us now with what we need to know about this. Dr. Patel, thank you for joining us again. How is this strain different from other flu strains, and why are health experts worried about it?
Important questions, Ike. So basically, when you think about what a subclade actually is, that word literally means below branch, and it's in the family tree of influenza viruses. So when people hear these letters and these numbers like H3N2, that is influenza A. When there's mutations on those surface proteins, the proteins on the outside of the virus, that's when we get to subclade. So subclade K has mutations on those proteins. People are paying attention because we're seeing cases earlier and we're seeing more cases in places, as you mentioned, across the world, with subclade K now being identified in Japan, Canada, and the UK. It's still unclear about what this might actually do to the US, but this is definitely why the global surveillance influenza system, yes, that exists, is on high alert.
Now, are there current flu vaccines effective against this new strain?
So the flu vaccine was actually created in a different subclade later in spring, and researchers are concerned that there may have been some mutations on the proteins that could make this flu vaccine less effective. However, early data does suggest there is some effectiveness, and an important thing that I want everyone to understand is the flu vaccine isn't perfect. No vaccine is. The percentage of effectiveness varies from season to season, but there is some good preliminary data out of the UK, and researchers believe that this flu vaccine this season has still a probability of protecting you and keeping you away from winding up in the hospital or getting severe disease. So it's still a really good idea to get that shot if you haven't already.
All right, now along with that flu shot, what else can people do to protect themselves?
Mentioned getting the flu shot, but also big surprise, please stay home if you are sick. You don't necessarily know what those symptoms really are. This is especially important if you're high risk, if you're going to see someone who's high risk, because anyone who might just have a common cold might not think it's a big deal, but it could be devastating in somebody else.
All right, Dr. Alok Patel, thank you for that information.